Hey, I'm Wendy. Welcome to the RN for God show. As a trusted healthcare professional, a RN for the last 24 years, I want to help you to discover how to be healthy. I'm going to guide you through the myths, the facts, and the essential tips that you need to live a high quality of life. The Bible says in John 10:10, Jesus came that we could have life and have it more abundantly. And I believe that he meant for us to have that on earth. Let's dive in, learn about health strategies so that you can live that abundant, healthy life right here on earth. Hey everybody, welcome back to the RN for God podcast show. Today we're going to be talking about kidney disease. So I've been mentioning kidney disease, renal failure, throughout other episodes, but today we want to take a deep dive into it. And I'm going to do my best to not give you a science lesson. So the kidneys are one of the body's filtration systems. You have a few others, one being the lungs. The lungs help us to expel gases from our bodies. Carbon dioxide is one. It gives us that gas exchange. The carbon dioxide is breathed out as oxygen is breathed in. Excuse me. The skin protects us and helps to minimize toxic substances getting into our body. The skin protects us from that. And then the digestive system. It helps to remove, it takes nutrients out of the foods and gives it out into the blood in the body. And it expels the waste through the process of defecation. So what the kidneys actually do, their function is to filter the blood and blood products, and then it produces urine. So if you think about a filter, I don't want to give you a long science lesson, but I want to help you to imagine how the kidneys are built. So they are like a shape of a bean. And inside they have a lot of little nephrons, and these nephrons are filters. And inside of the nephrons are glomerulus, and I may not be pronouncing that right. But it is a glomerulus and a tube. So if you think about a filter, in my mind, I'm thinking of a car filter, air filter. You know, when you get your oil change, they always say, hey, you need to get this changed. So those little white folded areas, think of those as the nephrons. And the inside of each of those nephrons is the glomerulus and the tubules. So the glomerulus filters the blood and the tubes return the substances that the body needs back into the blood, and the ones that it doesn't need down into the tubes, into the urinous to make urine. And that is how that waste is put out. So when we have other disease processes, diabetes and high blood pressure, which is hypertension, the compounding effects on the body can cause renal failure as well, kidney disease. So some of the things that you can do to help prevent kidney disease are, of course, exercising. I'm trying to tell y'all, movement is the thing to do. No sedentary lifestyle. So according to, excuse me, the American Heart Association, we should be moving about 2.5 to 3 hours a week, right? So you can work out 3 days a week, 30 minutes each. And remember, consistency is key. You don't have to do 30 minutes every Monday, Tuesday, Wednesday. Space it out. Give yourself some time to rest in between. And as you go, you will begin to build up and maybe do longer or even more days. But the key is to do at least 30 minutes 3 times a week. And that is to get your heart rate going and get your blood pumping throughout your body. Another thing that you can do, excuse me, is to eat foods that are low in sodium, which is salt, low in potassium and phosphorus. So I would recommend that before you even start changing your diet or anything like that, that you go see your doctor and you get blood work done. You have to get the blood work. I suggest you get the blood work done so that way you'll know where you're starting at. Because each of these levels, your sodium level and your potassium level, those are electrolytes in the body, and they are very, very important. So God is awesome in the way that he designed our bodies. Everything in our bodies is at a specific balance. So your sodium, if it's too low, you can become confused. You could become dehydrated, and the dehydration it's inside of your cells. So you will have to have special medications, a certain type of saline, to get the fluid to go back in, to get the sodium to go back into the cells. You don't want to drink a lot of water. What people think is that when they swell up, that is edema, and the fluid has moved so much into the spaces around the cells. That's when you need to drink water to push it, to push the fluid back into the cells. I'm saying that backwards, I think. So when your sodium is low, you need to drink juice and have a fluid, IV fluid, to help, a specific type of IV fluid to push it back into the cells. When your sodium is high, then you need to drink water to push it, to get it normalized. So you should have your doctor check it. Now, potassium is an electrolyte that helps to regulate your heart rate. So you definitely want to make sure that is within a normal range before you start eating things that could either elevate your potassium or lower it, because you want to make sure that your potassium is normalized, because if you have too much potassium, it could cause heart arrhythmias and it could cause renal failure. If you have too low potassium, it could also cause heart arrhythmias. And you don't want to have, when I say arrhythmias, that means your heartbeat is irregular. And you don't want to have a heart arrhythmia, because that could lead you down another pathway of detriment to your body. So you want to make sure that you talk to your doctor before making any changes to your diet or anything like that. So you can call your doctor, your primary care doctor, if you have one, and make an appointment and let them know that you want to have your labs checked. And if you go regularly, then they've probably already done that, and you can look them up and see what your levels are. And you can ask them, are they normal? So you also want to make sure that if you don't have a primary care doctor and you do have insurance, you want to make a phone call. You want to look on your insurance card and make a call to that number and find out what doctor you can call. Or you can look it up online, go to your insurance company's website and look for primary care doctors. Because a lot of times people have to choose one now, and sometimes they don't. And sometimes you choose one and you haven't seen them yet. So it's always a good idea to call your primary care doctor and make an appointment. And again, if you have not seen one, verify who it is through your insurance company. Call the office and make an appointment so that you can be seen. Now, in the case that you have either the Marketplace, Obamacare, which is also the Affordable Care Act, or you have Medicaid or Medicare, sometimes your appointments can only be like within a year apart or something like that. So you can also look on your phone. You can download the app that your doctor's office has. Sometimes it's called MyChart or some other form of you being able to visualize your own lab results and test results. So you can do that and look and see when your last blood work was drawn. And I would recommend, if it was not done within the last 3 months, then you should get some more done before you make any changes to your diet or anything like that. Now, if you don't have insurance, So, this is one of the problems that we have in our community, that a lot of people don't have insurance. And this is also a reason why a lot of people are having a lot of health issues and not getting treatment because they don't have access to health care. So, what you can do is locate your local health department, and you can Google that. Whatever city or state you're in, you can find your local health department, and you can call your health department and ask them, do they have any clinics that you can see for non-insured persons? So these clinics are there to help people that don't have insurance, that can't afford insurance. So what they do is they ask you your income. Yeah, they will be in your business because they ask you what your income is, and then you pay. Usually you pay according to your family size and your income. So it is a cheaper rate that you can pay. Sometimes people don't have anything to pay because they have nothing to give. But that doesn't mean that they can't be seen. So I encourage you to do those things if you do not have insurance. Yes, it can be a pain because they ask you all of these questions, but it's better to answer those questions, apply for the insurance now, or apply to get seen by a doctor now, as opposed to having some tragic event occur and you're hospitalized and your family is left with this humongous bill, or you're being asked those same questions in the hospital so that you can apply for Medicare or Medicaid at that time. So I encourage you to do that. Now, one other thing I really want to stress is that none of these things, cardiovascular disease, hypertension, obesity, excuse me, or renal failure, renal disease, kidney disease, they don't just start when you become an adult, right? All of these things begin at a young age. So the majority of people are born without any health issues, right? Yes, you do have some people that are born with some disabilities, but the majority of the society is born without any health issues. And as we grow, you really are what you eat. So everything that you eat, everything that your body is exposed to, what's in the air, the water, substances that get through your skin, becomes a part of us, right? We are what we consume. So it becomes a part of us. So the fatty foods, the fried foods, all of those things start to build up in our bloodstream, in our blood vessels when we're young. And as we get older, it compounds on one another. So persons that have diabetes, because diabetes already causes a vascular issue, an issue with the blood vessels, having high doses of fats building up in the blood vessels. Persons with diabetes more than likely will always have an issue with cardiovascular disease. But that doesn't mean that every person with cardiovascular disease will have diabetes. Okay, so I'm going to say that again. Persons that have diabetes will always have some type of cardiovascular disease. And that's just basically because of the buildup of fat that happens over a lifetime, over a time period, with the fatty fatty lipids in their body that builds up in the bloodstream. But every person that has hypertension or cardiovascular disease does not get diabetes. Persons that have hypertension, if their blood pressure is constantly out of control, they will eventually have kidney disease. So you have to be careful and be mindful. I know as a people, and even myself, when I think that there's something going on with my body, I'm like, okay, God, what is this? help me to not have anything really bad. But I call my doctor and I talk to her and I let her know, hey, this is what I feel. This is what I saw. This is what I felt. And I want to make sure that it's not anything bad. So she'll say, okay, well, let's do this test, or first let's check your blood, right? So the first thing they want to do is something that's really non-invasive. And our blood work tells us a lot of information. So the first thing they usually say is, okay, let me examine you and let's check your blood work and let's go from there. Every time people think, oh, well, you just want my money or this and that. But we have to do tests to see what could possibly be going on. And sometimes doctors don't get it right. Sometimes people don't get it right. So you have been with your body, however age you are, right? So you have to speak up and advocate for yourself. Listen to your body, because your body talks to you. Your body will tell you when something is going wrong. You may feel it. You may not be able to put your finger exactly on it, but you go and you speak with your physician and you have a conversation and you let them know. The worst thing you can do is be so afraid that you don't go to the doctor and that you don't tell them what's happening. And then it turns out to be something bad that could have been preventable, that could have been prevented by early intervention. So what do I mean by early intervention? So what I promote, what healthcare is beginning to promote, is prevention. So how do we prevent things? Well, we do vaccinations. Children get vaccinated to prevent measles, mumps, rubella, those types of things. They have a chickenpox vaccine and all of that stuff. So vaccination is one way. Another way is screenings, right? To make sure that you don't have things. When you get to a certain age, you'll get a colonoscopy. You get your eyes examined every year. You get your blood work done, right? So these are all screenings to help to make sure that there is nothing going on in your body. Women should be doing self-breast exams. Men should be doing self-testicular exams to check for breast cancer and to check for testicular cancer. So we have to do things to check our bodies. You should be especially people that live in Florida, you should be assessing your bodies for moles. If you have moles that that change shape, that look irregular, like they're not round and smooth, if they have a lot of lumps in them and they seem to be growing, that could be a sign of melanoma, which is a type of skin cancer. So you want to make sure that you are assessing your bodies. So this is a part of screening. And it is a form of prevention, because when you catch things early, then you don't have to go through that harsh turmoil of sometimes maybe cancer screenings, maybe chemotherapy or surgeries even. So you have to be aware of your body, and you have to use your voice to speak up for your body. So when you go see your doctor, you can talk to them and tell them what you feel like. What are your symptoms? You can tell them that you found a lump, or something hurts you, and they will make that decision on what needs to be done to move forward. So again, I can't stress to you enough that all of the things that I've been talking to you all about, it doesn't just happen right away in adulthood. It happens over time from childhood. So if you feel like you're in a position now where you can't make any changes, the devil is a liar. Because as long as you have breath, as long as you are alive, you have the ability to change. If you have diagnoses, you may not be able to change those diagnoses, but you can do things to make your body get better. If you are at a point where the doctors are telling you this is an end stage of something, there are still other things that you can do. I'm not a person that is a woe is me. I am a what can I do to be better? What can I do to continue to live and not just exist? So I'm available to coach you through, to talk with you individually, to help you to come up with a plan. I do some coaching as a nurse, and I want to help you. I can help you devise a plan that you can take back with you to your physician and have a conversation with them to help you to live that higher quality of life, to help you to maybe get off of that blood pressure medicine by through diet and exercise. Now, again, that's a plan that you would take to your physician and say, hey, can we work on this? Because I want to not have to take blood pressure medicine for the rest of my life. And your doctor can tell you, okay, well, because of the way that your blood pressure is, you may not get off of the medication, but yeah, you are overweight, so you can work on losing the weight and changing lifestyle habits. So let's see what happens when we do that. It's never going to be oh, yes, we're going to do that, because we don't know. Some people never have to take high blood pressure medicine, but they have high blood pressure. Some people have to take high blood pressure medicine and their blood pressure stays high. Some people are on 4 and 5 different blood pressure medications. So every person is different, and you can't go by Dr. Google, because again, that's a general perspective from everyone. You have to look at each person individually. So these are conversations that you as the patient have to have with your physician. Again, I can help you devise that plan that you can take back to your doctor and work from there. But I want you to understand that you have to start somewhere, because sitting on the couch, watching TV and acting like nothing is wrong is not going to help you. Okay? Again, sitting on the couch, watching TV, eating ramen noodles is not going to help you. You have to get active. You have to start moving. Even if you take a walk, even if you walk around in your house, even if you start to do little tiny changes, because those little tiny steps turn out to be big steps as long as you're doing those tiny steps consistently. Okay? Those tiny steps consistently equal big steps. Everybody can't do everything grandiose. Sometimes you got to take little tiny steps. Sometimes you got to start sitting in a chair and just moving your arms and maybe just lifting your legs up one at a time. Everybody is different, and you have to know what you are capable of. And then when you get to a point where you feel like, okay, I think I can do better, but I'm afraid to push myself, that's when you have a friend. You call a friend and you say, hey, can you come over, or can we do this together? Because I know I can do more, but I'm afraid to try by myself because I don't want to hurt myself, or I don't want to go through this part by myself, because it can be scary. Lifestyle changes can be scary. I have made quite a few in my life. They are hard to do. You have to give yourself the grace for the times that you fail, you fall off, but you get back up and you start all over and you keep moving forward. So just remember that every diagnosis, most of these things didn't start as when you turned 21, not 31, not 41, not 51. A lot of these things started young that our parents didn't know. We didn't know. the things that we did to our bodies. If you were young and you smoked and you drank, if you were young and you did drugs, if you were old and you did drugs, you don't know what you're actually doing to your body. So I don't believe in that, oh, you did it to yourself thing. I don't think that everybody is aware of what they're actually doing to their bodies. So don't beat yourself up. It's okay. We all make mistakes. But when you know better, you do better. Right? So now that you know better, let's start doing better. You can reach out to me. My website is IamTheRNForGod.vision, and you can reach out to me and I can help you to make a plan. If you don't want to reach out to me, that's okay. Reach out to your doctor and make a plan. Advocate for yourself so that you can live a high quality, fulfilled life and not just exist. All right? So thank you very much for listening, and I will catch you the next episode. Toodles. Hey, thanks for tuning in. Remember that your health is your wealth and knowledge is power. So like, share, leave me a comment, send it to a friend, and thank you for tuning in. I'll see you next time. Toodles.